I am Dr. Yaldandi. I am a clinician and an expert in infectious diseases. However, right from the beginning of my career, I have always worked in the laboratory. The laboratory is critical for making an accurate diagnosis of infectious diseases. Therefore, more than 30 years ago, I trained in the laboratory to ensure that I had the skill set to do the work needed in the lab that would allow us a correct, accurate, and precise diagnosis that would help our patients. Now, when I first started working in the lab, all I had at our disposal were simple instruments like microscopes, culture plates, and incubators. And yes, I did work in 1989 on the first Perkin-Elmer thermal cycler, the PCR. But today, let me bring you and show you what we have in the lab is a far cry from the almost primitive technology that we were using more than 3 decades ago. Now the technology that we use is truly a product of the space age and the product of this millennium that has vastly improved our ability to make the right diagnosis and also do it much, much faster than we ever could. In the old days, the earliest I could identify a bacterium or a virus or a fungus in the lab would take several days. Today, sometimes I can do it in minutes. So we have shortened the time taken for making a diagnosis. Not only that, the number of pathogens that we could diagnose 3 decades ago were just a few. Today, with the advanced instrumentation we have in our lab, we can correctly identify more than 4,000 different pathogens. The lab is where it all comes finding out exactly, precisely what is causing the disease. The lab is what tells us which would be the best possible antibiotic to use. I, as a clinician, would not be able to offer you, my dear partners, the very best in infectious disease treatment if I did not have a world-class laboratory with advanced instrumentation and cutting-edge technology.